everyone. I see the audience starting to fill up here. Welcome to today's webinar and live demo. Thank you for joining us. I'm Justin Veneri, Director of Communications at Capital RX. It's actually been about 11 months since we last hosted what was our initial demo of our Medicare prescription payment plan, or M3P solution. And with the M3P program in full effect now, we thought it'd be great timing and helpful to hold another open forum with a demo and to share what we're learning, to answer your questions, and to show you some of what we're up to here at Capital RX. So you'll see some of what our enterprise health platform Judi can do, what it allows for in and around plan member support and their experience. So I think you'll like that a lot. I see we've got a great audience here. It looks like we're up to over 20 people dialing in, or joining us. So I'm going to get started with the little housekeeping items I have, and then I'm going to turn it over to our speakers so that we can get started. Okay. So housekeeping items. We love interactive sessions. Please feel free to use the Q&A as we go. Second, we are recording this and we'll make the replay available. That's about it for me. I'm going to turn this over to Jason Barretto, Senior Vice President of Government Program Operations, and Ryan Kelly, our Chief Technology Officer. Jason, take it away.
Good day, everyone. Great to have you at this webinar to walk through the technology that we've implemented to support the M3P program. But first, we'll go a little bit through some of the little bit of the history and why we're doing M3P, as well as just showcase a little bit of what we've deployed as the solution. So let me just share my screen. Okay. So here's your home screen of Judi. We'll see that in a second. So joining me is Ryan Kelly, Chief Technology Officer. He will be actually doing the demo. So you guys will have a chance to see Judi live and have an opportunity to ask a lot of questions there. So just a couple of topics or a few topics to really cover today. We'll just go through the overview of M3P, talk a little bit about our solution, and then go into the live demo. And at any point in time, please feel free to ask questions. So just a little history about M3P. So it is something that went live on January 1st, 2025. We are almost a quarter into the program's life, and it really was designed to try to make prescription drugs more affordable for Part D enrollees. It came out of the IRA back in 2022, with requirements slowly coming out of CMS over the course of about a year, with the last biggest piece of requirements coming out in the summer of 2024. And the primary focus, or really the only focus of the prescription payment program, is to apply it to Part D covered drugs. CMS has three high-level expectations of sponsors, and that is to allow the program election prior to plan year, utilize the two CMS calculations to appropriately set the participants' monthly max cap. And then the last piece is to provide a likely to benefit notification to potential participants when they qualify at point of sale. So with all those things in mind, we at Capital RX decided to implement a solution not only for our PBM clients, but as well as for our non-PBM clients who we don't process prescription claims for. And so we do have an end-to-end solution that enables sponsors to, fulfill the program's regulatory requirements as well as operational requirements, so that they don't have to staff up and do all the work themselves. And so the program can be fully delegated to CapRx, and there is some opportunity to customize that where not everything is delegated. So again, kind of going into a little bit of what we actually implemented in Judi. So you have your program elections, your member notifications, member billing, program calculations, payments, ledger management, A&R tracking, and then your reporting. And so we'll double click into that a little bit here. So program elections, right, is kind of just being able to educate members, try to address all of their inquiries, opt members in and out, and we have the ability to support self-service from a digital standpoint. So we do uh, enable white labeling with our digital tools, member portal, our member app, and allow those prospective participants to learn more about the program as well as opt into the program. And then participants can actually manage all of the program particulars, payments, and notifications and all that within that environment. We do allow members to set their own preferred payment dates. And we do use text messaging, particularly for payment-based messaging. So letting them know when an upcoming payment is due, if they've missed a payment, if the payment did not go through, that type of stuff. Member notifications. So we do all of the required member notifications on behalf of our clients. So targeted likely to benefit. That's prior to plan year as well as during the plan year. Program opt in, opt out, grace period, preclusion, reinstatement, and then all of their invoicing. We also have a payments module. So again, allowing members to understand, even if before they participate in a program, to try to understand, will this program benefit me or not? So giving them a modeling calculator at their fingertips, both self-service on the web, or if they call into our call center, which is a domestic 24/7 call center, our call center agents can educate them on what may or may not benefit the member. Um, Billing and payment tracking. So all of the amounts that are owed by a member, all the payments that they've made, any adjustments that need to be made, all happen within our Judi platform. We also allow member full and partial payments, and we accept all of the major payment methods out there. So credit, debit, check, ACH. They can mail in checks, and we manage a lockbox, and they can do that through calling our call center, or they can actually use the digital platforms. And the last thing here is data and reporting. So we do provide our clients with a pass-through HPMS reporting, and we supply our clients with all of our transactions. So all the data that we collect on your behalf, we provide that to you in various files at various frequencies that we mutually agree on in order to get you what you need for internal reporting as well as any other CMS reporting that you may have. And then the last thing here is self-service reporting capabilities. So we do give our clients access to our reporting tool, which enables them to, beyond the standard data files that we supply, they can create custom reporting for their program needs. And then the last slide here is just our standard implementation timeline. And so we do provide the option of supporting our clients during AEP. So this is an example of the AEP support timeline. And so we would go live 10/15 versus 1/1. And this would allow you to kind of delegate some of those tasks around M3P inquiries, program elections, that type of stuff. So we start with um, we try to knock out all of the program elections by the client prior to June so that we can go into contracting, and those activities kind of go hand in hand and in tandem. And then we start working and going into the client setup. And so that's when the real implementation starts. Obviously, we can pull that forward, push that back depending on the client needs. And then we go into uh, some of the fun parts of exchanging data because we do not process claims on behalf of these clients. We do require certain types of data in order to fulfill the program obligations, whether that's eligibility, Part D eligibility, excuse me, uh, claims, both Part D and M3P, as well as PDE to support the likely to benefit notifications if that's delegated to us. And then before we actually go live, our teams do training. Typically, we do train the trainer, and we'll provide you with some scribe guides for reference, and then do Q&A, and then we go live. And during go live, we do support, again, clients during AEP, where we'll take all of those inquiries from both prospective members as well as members who have a future effective date, and we can opt those members into the program if they wish. And with that, I will hand it off to Ryan Kelly, who will give us a demo of the technical solution that we've delivered to the market. Thank you.
Great. Thank you so much, Jason. We do have a question. However, in the Q&A, Jason, will you produce the CMS M3P marks file? If you could go ahead and answer that while I go ahead and share my screen.
Sure. So currently we do not provide a pass-through marks file because there are some data elements like data def and things like that we typically do not receive from our clients in order to properly produce that file. But we do produce all of the necessary data elements to support that marks file. And we also provide a mapping document to help you map our data to the marks file.
Great. Thank you so much, Jason. So for those of you who are not familiar, this is, well, actually first, maybe I'm Ryan Kelly, Chief Technology Officer, co-founder of Capital RX. This that we are looking at is the Judi dashboard. There's a lot of functionality, a lot of capabilities built in here. Our conception of Judi as a platform is to put everything in one place. And so today, going to be talking about the Medicare Prescription Payment Program. All of the capabilities related to that program and our administration of it are present here in the platform. I'm going to hit on a couple of key areas throughout my demo. Really going to be focusing most of my time on the member experience, but we will spend a little bit of time touching on the kind of the administrator experience, specifically as it relates to invoicing and payments. So with that said, I'm going to go and bring up my demo member here. High level, we're going to land here on the member demographics page. I'm going to go first here to the claims section for this Medicare beneficiary. You can see here that we have a claim for Cosentix that has been filled. You can see here this patient paid amount of $330. You can see this next claim also for Cosentix, also for that same prescription, but you can see here that the patient paid amount is $0. And this is that secondary claim, that secondary M3P claim that we have bought the member down to $0 with. And this 330 you'll see in just a moment as we work through some of the members' financials. I'm gonna go here. We have a specific Medicare prescription payment plan tab just for the purposes of administering this program. All of the relevant and necessary information that you need to know about a Medicare beneficiary's participation in the plan can be found right on this tab. So trying to keep everything together in one place. If we provided notice, when the election was, what the election channel was, and we'll actually go into some of the mechanics of the election itself in just a moment. If we need to provide additional notice or send information or update the due date for a beneficiary as it regards their payment timing, we can do that here. Customer care representative, either our customer care team or your customer care team can go ahead and make those updates. If we need to make any changes to the beneficiary's communication preferences, we can edit communications here as well, and also manage their grace period. What I'm going to do to begin is I'm actually going to opt this member out. So let me move the Zoom control, and I'm going to click opt out here. And you can see that this beneficiary is now terminated, and it's a voluntary termination. You can see that the termination date correctly reflects here today's date. A little bit more interesting, however, is to opt the member in. So I'm going to go here to the opt-in screen. And you can see here we're supporting all of the different channels for opt-in. This is something, of course, that can be delegated to Capital RX on a full basis. If you want to handle some of this yourself, you can do that as well. I'm just going to choose telephone. The election type, in this case, we've got a few different options here. Complete support for all of the options that CMS requires as it relates to the election here. I am going to choose, let's say, approval, subsequent participation, and then I'm going to choose an effective date of today. And you can see I've got a communication preference of mail here, and I'm going to go ahead and save that. Voila, I am now back active and participating in the plan. Also found here on the member level view is going to be information related to the beneficiary's payments and spending as part of the program. So remember before we took a look at that claim was for $330. So the member essentially has a balance that they accrue of $330 there. The beneficiary here has made a payment of $166.67. If we scroll down here, we can actually see the record of this payment and how that payment was made. So you can see that their payment method here is check, and their total paid year to date there. We can also see the difference between that 330 and the 166.67 that has been actually paid. So that's a total amount outstanding that the beneficiary still has to pay under their participation in the program. We additionally have kind of a table showing here kind of a maybe less interesting estimate. Not a whole lot of activity associated with this beneficiary, but you can see here it goes across, making an estimate there. We additionally have tools to support essentially beneficiary decision-making, whether or not they'd like to participate in the program. So let's say that, I'm not participating and I've called into the customer care center and I'd like to, understand a little bit better, how does the Medicare prescription payment plan benefit me? The customer care agent can assist the beneficiary by asking questions about what are your monthly costs, or they could, of course, review their claims information to get a display like this, estimating what their cost would be under participation in the plan. So we have the payment calculator here in the member level view. We additionally have a payment calculator available in the member app. So we have both a web and a native mobile version of our member app. I'm just going to go quickly over to the website to kind of show what that looks like there. If I click learn more, I'll be presented essentially with the same calculator view that we saw on the previous tab, assuming I have not been logged out because I've been speaking in this demo. Let's see what if I can get it to pull up here. Well, my participation details are still good. Well, calculator's still loaded. So the calculator view here allows you to input your expected monthly costs, the month, and the year. Obviously, really 25 is kind of the most relevant plan year now, and you'll get this kind of graphical form and this tabular form down here again, so that customer care representative can help service the member. We have this record history tab, which is going to show here at the top really details about the beneficiary's participation in the program. So you can see here, we've got an approved new election with the record date. I've opted out. You can, or voluntarily terminated, I should say, or opted out, but we've opted back in and out and in and out. Obviously, this is a demo member, so I've gone through this a couple of times. Down here at the bottom as well, we can see payment configurations, how this particular beneficiary prefers to pay for their participation in the program, and it is checked. Lastly, any notifications that we are sending to the beneficiary are also here in the platform. And you can see just the list of all of the notifications that we have sent to the beneficiary. The next thing that I'm going to do is I'm actually going to jump over to the app side. But before I do that, I just want to highlight one thing here. We have the ability to emulate into the member app on behalf of the member. So if, for example, the member is having an issue with the app and they need customer care to support them, the customer care agent can emulate into the member's view so that they can actually see what the beneficiary is seeing in the app. I've, of course, already got it open, so I'm just going to go over here. Of course, now that I've come back to this tab, my calculator has loaded. I was not so smooth in the demo, but you can see here, same experience as we just saw on the previous tab. I'm going to go over to participation details. Much like on the customer care side of things, the beneficiary themselves can opt out or, of course, opt in to participation in the program. You can see here, this is actually the original opt-in date because we essentially have a continuous stream of eligibility because I've kind of opted in and opted out on the same days. Down below, as we saw on the previous screen, same total payment amount due and what the payment due date is going to be. So that is 11 days from now. If I would like to make a payment, so of course, our preferred payment method here is going to be check. But if I would like to make a payment, I can click here on the make a payment button. And we'll be presented with a kind of a very familiar form. Just, you can put in, of course, your credit card information here if you're going to be paying by credit card, or you could choose bank account, ACH direct debit to have that payment come directly from your bank account. This here is a one-time payment. Of course, if I were to change my payment method up here, we could configure ongoing support for payment based on a credit card or bank account. As Jason mentioned earlier during his slide presentation, you can pay the full balance, or you could choose other amount here, and you could pay another amount, a lesser amount, a partial amount. You don't have to make the full payment every single time. So that's a nice feature to help support Medicare beneficiaries who, again, the program is targeted at those who have affordability. So this is just something to help them in that way as well. You can also change your communication preferences, just like on the customer care side. And here's a really neat feature that I especially like. The year-to-date balance shows how much you've accumulated and how much you've paid, but you can also see what claims went in to calculating these payments. So I'm going to go and click so that we can view the claims history that's relevant to this particular transaction. And you can see here, this is actually the original claim where the beneficiary had that $330 patient pay amount. And then the subsequent Medicare prescription payment plan claim that brought that member's responsibility at the point of sale down to $0. And this is really going to be the relevant claim. Of course, if I were to just filter them, you can see this here. I only have 2 claims net paid here. So only really one claim to kind of look at there. Jason, is there anything you would want to highlight on the on the app side before I go back into Judi and talk about invoices?
Yeah, I think there's kind of 2 things. One here on the screen, you could actually export the screen into a PDF if you wanted to, which is helpful to some members who may want to take it back to their prescriber, or share it with someone who they want, helping them understanding their prescription history, whether it's their pharmacist or a loved one. Being able to have that either hard copy or soft copy readily available is a nice feature. And then additionally, any member notifications would also be retrievable here. And so they could go into their inbox, and if they had member notifications, they would be able to retrieve them right here, which is a really nice feature. They could download them and reprint them. And so it is a nice feature for members to self-service.
Great. That is an excellent point there. Again, the whole set of features here focused on beneficiary member self-service. So excellent. I'm going to go back into Judi, and I'm going to click out here on the Judi logo to go back to the dashboard. And then I'm going to jump into the invoicing and payments component of the Medicare prescription payment plan. There's kind of two main activity flows here. One is going to be invoicing. So that's going to be the creation of invoices that ultimately will get sent out to beneficiaries who are participating in the program. And then there is going to be payments. So what has been paid, how much has been paid, how much is outstanding, so on and so forth. So the invoice process runs in a batch. And you can see here we have, again, this is the demo environment, so we only got really one member participating, but this one invoice that has been created for this beneficiary, the total amount billed, and of course the relevant time period for that. Invoicing runs, really just gonna kind of consolidate all of those together to show you that time period. And then over here on the payment side is going to be showing what the beneficiary has actually paid towards their participation in the program. So there's two components here. One is a billing adjustment, and the other is a proper transaction that we have actually received and managed. So in the case of a billing adjustment, there sometimes is a need to account for dollars that the beneficiary has sent somewhere else. So we're going to take those dollars off of their bill. On the transaction side, you can actually see here the individual transactions associated with this beneficiary. Scroll over here, get rid of this scroll bar. You can see the transaction amount and the billed amount. And you can see that the billed amount is actually lower than the transaction amount, again, kind of reflecting that less than full payment there. This has been paid by check. And so you can also see which lockbox this check has been paid to. We're splitting out all of those different check payment streams by lockbox ID. The other thing, sorry, trying to move this Zoom control. It's really stuck at the bottom of my screen. The other things that I kind of wanted to highlight, and really more of just a talk over kind of component, because they're not essentially like that interesting to demo. Here in the data exchange module, we have support for real-time data integration with really essentially any entity. But for example, if we are managing as part of the workflow the opt-in, opt-out for beneficiaries, we can actually push that information in real time to integrated partner systems. So if we're not the primary processor of those Medicare claims, we can push that information in real time so that information can be immediately reflected in whichever partner system we're working with, so that beneficiaries do get the benefit of the Medicare prescription payment plan immediately at the point of sale. The last item here is data output and reporting, and this is a fully integrated component of the program. We have the ability to report out data from the program, and there's a lot of different data elements, and I won't go into all of them, but the ability to report out data from the program kind of on a self-service basis. So you could set something up here yourself, the account manager could set something up here, but it's also a component of our Medicare prescription payment plan offering. And that being said, I know I've kind of gone through a lot. Jason, do you have anything you would like to add or anything else you would like me to actually show?
I think just kind of going back to the payments adjustments, one of the real life scenarios that our clients use this today for is they don't delegate lockbox to us. And so all of the physical check payments that they collect, they actually use this feature to make those adjustments based on payments that they've received. And so the process is fairly simple. You click on the upload file button. It gives you essentially a short instructional. It actually gives you the template in Excel that you need to populate. And then it's a, drag and drop right into the tool. And it tells you in real time, once it processes, if it's successful or not. If it's not successful, it gives you error messaging and how to fix it. And again, at any point in time, you do have account management support, so you can always reach out to your a dedicated account team to support any inquiries you may have. So this is a really nice feature. Again, Judi really was designed for efficient workflows, and so giving our clients this self-service capability is critical to maximize those efficiencies.
Excellent, excellent. Um, anything else, Jason, or should we turn it over to Justin to crowdsource some questions for us?
Yeah, let's turn it over.
Excellent. So thank you both for running us through that demo and showing us what you've designed Judi to do. We've got some awesome questions already. And while I'm taking a moment to organize those, we have a quick poll that we'd like to launch. It's just 3 questions. It'll take you a couple seconds, and we'd appreciate your responses to that. And let's see here. We've got, first one is, I'm going to direct this to you, Jason. So the platform looks great, but how is your solution actually different from the other M3P solutions in the market?
Sure. So the main difference between our solution and others is we are the only Medicare claims processor in the market to actually offer up a full end-to-end solution without us having to process your claims. And so that's critical because we understand our health plan clients and their needs because we work with them every day on their needs with CMS, their needs with their members. And so we understand the criticality of regulatory and being compliant first. And we understand the nuances and complexities of Medicare. And so that's what makes us different is we do this every day. And so being able to provide this to clients outside of claims processing is very unique to Capital RX.
Got it. Thanks for that. I've got a few more. Can your M3P solution be customized?
Yes. So there are certain features that can be customized. Things like what type of payment methods that you accept as a client. Some of the data files and data exchange that we do can be customized. And then some of the components around like, do you want us to manage your call center? Do you want to manage the call center? Do you want AEP support? Do you not want AEP support? So there's different components that we can actually customize. We can white label the member experience. So there's a lot of features that we can actually customize.
Great. Okay. Ryan, thanks for showing that while we're talking here. And as a reminder, anything pops in your head, use the Q&A box below. Does Judi allow members or the client to see which program documents have been delivered to the participants?
So at this moment, what you can see are the documents that have been triggered for delivery. And we are actually releasing a new feature next quarter that will allow you to actually pull up the document itself. So be able to open up the PDF and view it yourself. And so that feature is coming soon.
Okay. And one more here. How does Capital Rx stay compliant with CMS standards for the M3P program?
Yeah, great question. So we actually do have a regulatory change management team that is responsible for collaborating and coordinating with our internal legal regulatory team, our compliance team, our government programs team, as well as third-party consultants and resources, tools to basically ingest all changes that are happening across Medicare. And then we work cross-functionally internally to make sure that we interpret those requirements, understand the operational implications, and then put together a plan to deliver a timely and accurate and comprehensive solution for our clients. And all that information along the way is shared with our clients through the account team, so they're aware of what's happening at different points in the life cycle of that, whether it's a policy change, regulatory change, whatever it may be. We have a full end-to-end team that manages that process and keeps our clients aware of what's going on.
And one thing that I wanted to kind of add on there to what Jason was saying is, Jason mentioned before, we're the only processor of Medicare claims that's offering a solution like this in the marketplace. So we are very familiar with CMS, with the regulations, with the workflows, and with the need for timely fixes, timely remediation, timely changes that can come along with that. And so our software development organization and our product teams are organized in such a way to really make sure that we're supporting that regulatory compliance, because as an organization, as a business, it's something we're very experienced with and something that we're very sensitive to.
And that's all I've got, gentlemen. So, any closing thoughts? Anything we didn't cover that you think you want to reiterate for the audience?
The only thing I would say, kind of closing, is we've given you a nice overview of our program. Obviously, there are a lot of details that we didn't get into that we can always get into offline on a one-on-one basis. So please feel free to reach out if you do have questions, and we can have those further discussions.
All right. Well, thank you very much for joining us today, and I hope everyone has a great rest of your day. We'll follow up with the replay.
Thank you.
Thanks, everyone.